Well, going forward from Murang'a to Busia is that the county government of Busia, in collaboration with the End Malaria Council, has launched a drone-powered anti-mosquito spraying operation targeting high-breeding areas. This initiative aims to reduce malaria prevalence in Busia, with currently recordings the highest infection, rates in the country. Mary Nyambura has the details.
Speaking during the launch of this operation in Akriamasi village, Teso North constituency in Busia County, the Deputy Governor Ada Odera said that there is need to work on lowering malaria prevalence in the county, citing that at the beginning of last year, the prevalence was 39%, which was the highest in the country.
At the beginning of last year, we were at 39% malaria prevalence, the highest in Kenya. And I want you to see that in terms of what it costs to treat, the amount of time people spend in bed or seeking treatment for malaria, and the amount of time our medical personnel spend on treating malaria or attending to malaria patients. It's a massive loss to the country. It's a massive cost to the economy, and that's why there's all concerted efforts to try and reduce the malaria prevalence in the country.
Willis Okwale, who is the secretary at the End Malaria Council, said the reason they opted to use the drones in the operation was to ensure that the insecticide reaches all mosquito breeding sites, and also stressed on the need for children and expectant mothers to make use of mosquito nets and get early treatment in case of infection.
And the purpose of deploying drones is to ensure that we reach the breeding sites. There are many breeding sites. Some of them can be done manually, small, but in Busia, as you know, you have massive breeding sites because of the big swamp areas that you have. Many of them cannot be reached. So we deploy the drones to go and spray a biolarvicide, which basically is a kind of insecticide that targets the immature, the growing, the larval stage of the mosquito, and kills them before they become adults. Last time when we did the spraying in Busia, I'm covering about 17,000 hectares of breeding grounds. We had a 95% reduction in the number of adult mosquitoes that would have caused infection, which is, as you can see, very massive. In terms of transmission, Busia has the highest malaria transmission in the country as a county. And that is why putting all the strategies, indoor residual spraying, larviciding, using nets, and ensuring that especially children and pregnant mothers get treatment on time are very key to ensure then we achieve that malaria-free.
During the launch, Isaac Maluki, who is a member of End Malaria Council, noted that the local manufacturers can come together and manufacture some of the materials they use in the exercise, since they import most of the
majority of the items that we use. Unfortunately, we get to import them. And that's unfortunate because that's business that is going away from the country. These are things that if we were able to bring together, not only are we going to be helping to fight malaria, but we're also going to be helping to build our citizens because of the job creations that are going to be created. So as a manufacturer, as a local manufacturer, that is one of the things that we're really emphasizing on how we can see the way that we can start building that manufacturing and reduce our dependency on importing items that we can definitely make in this country.
Dr. Susan Outa, the Chief Health Officer in the County Government of Busia, who was also present, urged community members to also ensure they take action to lower the cases of malaria infection.
There are simple things that the community can also do at their level, ensuring that they sleep under a treated mosquito net. As the CEC has informed us that we have already treated mosquito nets in the household level. So they need to ensure they use those mosquito nets, and also to ensure they clear the bushes around their compounds, and they ensure that they clear also the stagnant pools of water.
Reporting for Catholic Focus, I am Mary Nyambura.